I am Jyothy Lakshmi from Kerala. I have completed Masters in Social Work with Medical and Psychiatric Social Work and MPhil in Social Work. And after that, I have worked in different settings as medical social worker, as faculty of Department of Social Work for 6 years. And after that, I joined in an NGO for 1 year as psychosocial consultant. And being a social work profession, I was very happy. I had happy moments and at the same time sad moments, because sometimes I do enlighten with many things, and at the same time that regard with the profession, and at the same time disillusioned with with the system. It's like many most of the time I do feel helplessness that time. I don't know how to move forward, and at one point of time I thought, okay, why should I stay with this profession? I can change the profession also like that, because whenever I see any for example, when I was working as a medical social worker in a hospital, that time I used to encounter many types of unethical practices that is related with the system, not with a person's. As a healthcare professional, I could not able to tolerate many of the things, and but I don't know how to give a direction and solution to the most of the problems. Like for example, that is dealing with ethics itself, hospital care ethics. Like then I entered, actually I do like teaching very much. So I got a job as a faculty member in a college. So I joined, and that is a different setting. But there also system errors are always there. Of course, it is a society, we can't blame also. Then by coincidence, I know Sabu sir, research officer of SOCHARA, and actually Sabu sir introduced me to this course, and he used to motivate me, okay, this is a different, you will get a different perception of, I mean perspective of healthcare, you come and join this course, like that he said, and he only motivated me to join, and this is my journey towards SOCHARA. Actually, I am more focused now. Earlier, whenever I see anything wrong in the society, maybe it is it depends upon the situation. That time I used to raise a question in my mind, why like that. And as far as health is concerned, this SOCHARA experience, give me many new inputs and a new dimension of healthcare. That is how to deal with the root cause. It's like earlier I was succumbed with the institutional care and giving counseling as a social worker. I do counsel the patients, family members, like that. But when I entered into SOCHARA, I learned many things from SOCHARA. One is that is cultural specific, how to deal with human beings while they are in distress in such a way that to as a empathetic understanding towards each and every person. And also the social determinants of health. It is not only confined with the four walls of the hospital, it is more than other than that. And how to how many concepts I learned from SOCHARA is like it's an enriching experience. Like for example, how malnutrition, what is the root cause of malnutrition? It is related with patriarchy. Earlier I didn't connect this with patriarchal system and malnutrition. When I reached SOCHARA, after having this much experience, I didn't know that there's a connection between malnutrition and patriarchy. These sort of it's a while hearing it is a simple thing, but it counts a lot. I took MSW, and I thought that after exit from that MSW profession, I can join some institutions and I can change the world like anything like that. But the world is not so easy. But when I reached SOCHARA, what I learned is like, okay, we can change, we can make changes in the world through small steps. I was in hurry to change the world, but it is not, it's a gradual process. Change means positive change. And personally also I gained many things, professionally also I gained many things from SOCHARA. Ravi sir used to say Vasudhaiva Kudumbakam. No, that itself connotes, how that simple sentence conveys lot of meaning to me, and like that I can reflect to the society which I am going to work. And each and every faculty members are giving, they are unknowingly or knowingly, they are sending us both, personal values and professional values together. So that itself is very, that is helping me to move forward. That's strengthening my own basic, my own mistakes and weaknesses. Actually, the uniqueness is like we are not students here. The course itself is very flexible. We have our own choices, because it is not like a four walls. Within the four walls we are sitting, and they are teachers, they are coming and dumping many information on us. It's not like that. Most of them, we are co-travelers. Like, it's an exchange of ideas, and they do facilitate us, motivate us in such a way, encourage us. So SOCHARA's experience, and another thing is that it's not only theoretical. We have enough time to explore the world, to go outside the world, and 6 collectives, 6 months collective, it is alternative to 2 months, 6 months collective, 6 months theory. So that itself is because we are getting first hand experience, not just mugging up the theory part. What we learnt in our theory class, we got an opportunity to imply in the practical settings. That itself is, that is a uniqueness. Of course, in my MSW class also, we had field work, but not this much. It's like 2 days training program, it's like that, and 1 month. It is here, it is different, 6 months theory and 6 months practice, that is 50-50%. So that itself is, we'll get first hand experience, and we are seeing the living documents. So that is more important, more than theory part. So that fieldwork experience will help me to connect the theory what I learned and the difference in the field also. Sometimes there is similarities, at the same time some uniqueness in the culture of that specific field area which I posted, like that. Actually, I happened to be 6 months in Accord, Goodlore area. That is, I did my placement with tribal community people. That is a unique experience because their culture is different. It's a confusion of culture. Simply, I can say that. And like most of the times, I do confuse with, like how I can transplant my. Okay, I am from a different culture, and they are from different culture, and their culture and traditions are entirely different from the mainstream. So when I started as a field worker there, I strengthened my skills to transplant, to exchange my skills into their skills. That is a transplant of my skills. That is the important thing, and we need to be culturally competent enough to deal with them, and we should be very much compassionate. 2 things I learned from there is that, okay, we should have the cultural competence to deal with different culture people, and we should not relate our culture with their culture, because the social context is entirely different. And another thing is that the communication, how we communicate. Earlier I was so biased how to go to the community, how to interact with the local people, tribal people. I don't know how, many things, I was frightened to go, like, but slowly I can pick up, and I started to establish a good rapport with the community people there. So that itself was, so we should be culturally competent and compassionately competent. 2 things are very important. It's not compassionately competent, you would say, we should have the compassion to communicate properly.